Welcome everyone to the Medicare Secondary Payer Multi-Carrier System Claims. It is important to understand that the multi-carrier system claims is key for this webinar, and I'll explain that in just a moment. Let me introduce myself. I'm Tom Ryan with Provider Outreach and Education. I'll be your presenter today. I've been presenting for over 20 years with Medicare, so I've got a lot of background and information. Today I am joined by Karen from my team, and she's going to watch and monitor that chat for you down there for questions, for other things like that. She's also going to give you resources, so I do really want to encourage you to take time to read that. The multi-carrier system claims are claims that are sent in two ways. One, they're paper claims sent in on the CMS 1500 claim form, or they are sent in on the HIPAA standard 837P electronic transaction. We did receive some questions about FIS claims. Now, the MCS, or the multi-carrier system, are what we're here to talk about today. FIS is the Physical Intermediary Standard System. That webinar was actually held on 9/9/2025 and is currently available in the Encore presentation. The FIS claims are your UB04 and 837I claims. I'm going to give you two examples of questions and things we're not going to answer today because they're part of the FIS system information, and I don't want to confuse anyone. So what does the MAC return reject when the diagnosis code submitted is not the diagnosis code listed in the common working file? That a return is something used in FIS. It's not used in MCS. So terminology that also came from a biller who told me, hey, I bill on the UB04 or the 837I. Also, what exactly does Medicare pay for secondary and how do I submit through DDE? DDE is the direct data entry. It is not available for MCS. I did have 3 or 4 of you ask that question. What is DDE? Why can't I have access to it? But then you told me that you bill on a 1500 or an 837P, and the answer is you can't have access to it because it's not available. All right, move on to a little bit of housekeeping here. Housekeeping, if you want the presentation, please feel free to download that today. It is available on our website. You can go to the live events page and get that information in the training center. It will be available either later today or tomorrow. It will come down, but then we're going to put it back up on the Encore presentation once this recording is loaded to YouTube and we have an Encore presentation available. That might take a couple of weeks. Today, we will only take questions in the chat. That does mean that you can put whatever question you want in the chat at any time, and Karen will monitor those. If it's something not related, she may answer you back. If it's something that she wants me to answer during the seminar or the webinar, she will actually present that to me later on. Last, you will be given the opportunity to take a survey at the end of the webinar. It is important that you take the survey and provide feedback. We're really looking for what you like, what you didn't like, but not just on the survey. You'll be given the opportunity to grade WPS as a whole. Karen will put a link in that in the chat right now for that survey, but again, we'll give it to you multiple times throughout, more focusing on it at the end. I'll talk a bit more. Little bit of the disclaimer, just kind of keeping everybody where we're together. This is an informational only class. We will give you some basic billing advice, but one of the things that happens is some of the questions that come in, people will try to make a question work or try to fit the question to what they want. Well, if you didn't give me the details, oops, and the facts, I can't always address those questions. So please make sure you're aware of that. As an informational only, this is for education purposes. Therefore, the information on the CMS website will always be your current coverage rules, regulations. WPS website does offer guidance, but it is not your current rules, regulations, and not your official Medicare information. That is on the CMS website. So it's important to make sure that you differentiate between the two. What are we looking at today? Well, we're looking at claims billed to Medicare through the multi-carrier system, again, through the 1500 or the 837P electronic transaction. We want to talk a little bit about claim submission. We want to talk about some billing situations. And then last, we do want to address your questions to make sure that we don't miss anything. So let's go ahead and start with claims submission. Um, this section is designed to answer some of those basic questions. I will have to step back a little bit because I did get some very basic questions on Medicare Secondary Payer. And so that information will also be in here. I tried to work it in with the general billing rules as well. So that's where the first slide comes from. What are those basics that you have to read, or when you read something, all of a sudden it says, hey, you still have to meet all the Medicare rules? That's your basic information, such as your patient information. What's their Medicare beneficiary identifier, as an example? What's the name according to Medicare? Those will not be MSP denials or MSP information. It's just general overall information. Is your provider enrolled, and do they have a national provider identifier? What's the data service procedure code and diagnosis code? Again, not anything to do with Medicare Secondary Payer, but as part of that, you do have to meet these basics. Otherwise, you'll never reach the Medicare Secondary Payer edits. You're actually going to get rejected before that. And that rejection is called unprocessable, which simply means we don't have the information we need. We can't do anything with your claim. That's what this is meant to address. So while there are some pieces of information that will cause an unprocessable that are specific to Medicare Secondary Payer, and we'll talk more about that, any of these basic pieces missed will not even allow you to reach this Medicare Secondary Payer edits and audits within our system. One of the confusing things that someone did ask about is these type codes or these health codes, these plan codes. I actually had a variety of different things that people were referring to them as. So Medicare does use what is called a type code within our system. And many of you may not actually see this as a quote unquote code you type in, two numeric digits. You might not see that. You might select something from a drop down that then gives you further information and your system translates that. We've also heard that. So here's a couple of things to keep in mind. In the Medicare system, the type code 12 represents working aged people age 65 and older who have 20 or more employees. Well, what is working aged? It means that the person themselves or their spouse is working, because you can be eligible under a spouse. There's a couple of other people you can be eligible, but those are the two most common types. The Medicare recipient, the person having Medicare, is age 65 or older, which is when the standard age effect rule comes in. Now, they're determined Medicare eligible by the Social Security Administration or Railroad Retirement Board because they are 65 or older. I did have an interesting question about that. Someone asked, is it actually their 65th birthday? And the answer is no. It's actually the first of the month in which they turn 65. But there's also a caveat. If their birthday is the first of the month, it's the first of the month prior. So if your birthday is December 1st, you will be eligible November 1st. If your birthday is December 2nd, you'll be eligible December 1st of the year in which you turn 65. So when we look at that, that is one type. It can cause denials because when a group health plan is primary, is based on the number of employees that have full-time employees or their equivalents that can be covered under that plan. Now, we, as your Medicare administrative claims processor, we don't determine this. This is not something that we determine. It's determined by the Benefit Coordination and Recovery Center, and it's part of their job. So you will want to make sure that you're coding it correctly. There is another type, and this is called 43. And yes, I know I skipped 13 on the slide. We'll come back to that, but let's just talk about 43. The other type of Medicare eligibility is for those that are under 65 and deemed eligible due to disability. Now, with most diseases, this requires a 24-month waiting period. However, there are notable exceptions such as ALS. So with that, why is this so different, and why does this affect how a claim processes? Well, if you notice, the second bullet under 43 says 100 or more employees. It's still the Medicare beneficiary, their spouse, etc., that is eligible through an employer group health plan. However, the group health plan is larger. It has to have 100 or more if they're under 65 and eligible due to disability versus 65 and older and eligible due to age, 20 or more. So Those two factors do play a contributing factor into the denials. If people code those wrong, we can actually wind up with multiple claims on the system, which stops the coordination of benefits system, the one that the Benefit Coordination and Recovery Center actually uses. They put that information into the common working file through the Social Security Administration. The common working file is just a general communication hub. The Social Security Administration is the eligibility records. So all of those tie together in this communications hub. But if you put the wrong type of insurance code on there, you can actually cause all claims, not just yours, but all claims to stop processing while Medicare investigates whether or not they have a working age plan, a disability plan, or other types of plans. Another type of plan that we don't see as frequently, and only because there aren't as many people eligible for Medicare with this, is end-stage renal disease. End-stage renal disease means that you're diagnosed with end-stage renal disease, it's reported, and therefore that's what your Medicare eligibility is based on. It is a separate section of the Social Security Act. That's why it's not considered under the disability area. And because of that, in that section of law that put the end-stage renal disease eligibility into effect, it did not talk about a set number of employees to make it primary. So that one doesn't go into effect that way. Instead, it said, oh, wait, we're going to do a 30-month coordination period in which Medicare will be secondary for the first 30 months of coverage. After that, Medicare will be primary and the other in-group health plan will be secondary. So again, these types of insurance definitely affect the claims processing. The wrong type can actually send a message or indicate a bunch of other things to happen. So we want to make sure that you're putting the right type that's coded on there. We did have a question that came in and they said their claims are actually denying because everything coming to us is saying that they aren't doing it, but when they look within the system, it's coded. We're just not getting it. This is a communication issue, is what it sounds like to me. And it really means your software vendor, the electronic people that work with you, need to contact our electronic data interchange department and figure out where that communication is failing. Something's not crossing to us correctly is basically what I'm saying. And without that information, we will continue to do the unprocessable until we can get that. We'll talk more about what you can do in the meantime while that gets worked out. There are also another set of primary payers. Now, these are not employer-based plans. They are accident, illness, or injury-based plans, and you're probably pretty familiar with these, but Medicare also asks you to code appropriately. So for instance, 14, no fault. No fault can be an automobile or another type, but it is defined by a state benefit. So your state will tell you whether the automobile falls under no fault or whether it falls under liability insurance. Again, that's up to the plan itself, or the state and laws. 15 is workers' compensation or a set-aside amount falling under workers' compensation. That just simply means that a law suit has been filed, settled, it's done, and there's still this money that was put into like an area and it's set aside for that particular lawsuit, that particular accident, illness, or injury as related to a work item. So workers' compensation is an open case, a set aside is a closed case, but there's still money waiting for it. Public health services, it's a research grant. They are primary to Medicare if there's a research grant in place. Not as often that we see those ones, and there's a little bit of confusion over that. So you want to make sure that you are well aware of those rules. I don't want to bring it up because we don't have denials related to it because it's so infrequently billed to us. The Federal Black Lung Program is a form of what used to be called coal miners insurance, and it's when they have cancer or other things related to black lung disease. This is a Department of Labor workers' compensation program, so it works the exact same as regular workers' compensation that you would know as a 15, but the federal black lung, you just bill it to the Department of Labor, and they cover it in that way. So it's all part of a federal law that was put in place. It's a little bit different than workers' compensation, only in that who you bill is different. And last is liability insurance, and that's the 43s and 47s. And again, liability is state defined. Is it no fault or liability? That's state defined. Now there are some things that we know are automatically going to fall into liability insurance, such as malpractice insurance, things like that. So, but mostly we don't see as many plan type code errors affecting the claims as we do for employer-based plans. Those tend to be the bigger ones. Now, I will tell you, there are a lot of people that automatically default to using 12. Let me refresh you with what 12 is. It is an employer-based plan for working age 65 and older. If your system, for some reason, defaults to 12 and you submit with that, but it is one of these plans, it really affects your claims processing, because these plans are only primary when it is related to the accident, illness, or injury. The working age plans are for everything. There's nothing that they're not primary for, unless that plan excludes it, in which case you even have to give us an explanation that it's excluded. This is causing a series of denials within our system. So we want to make sure you get those coded correctly, because this is not going to work if you don't have that coded right. I did receive a question, and I'll address it now. They asked for the non-employer group health plan type for the VA or Veterans Administration. Now, they did use the term VA. I'm going to assume they mean Veterans Administration. I want to let you know that there is no primary payer type for the VA. The VA is not a primary payer to Medicare. Instead, the VA is a payer. Medicare is a payer. They are both federal government program payers. You can only get payment from one federal government program. That's it. So there's no like primary insurance type for it, because if you receive payment from the VA, Medicare will not pay. If you do not receive payment from the VA, then Medicare will pay as primary. The patient picks whether they want that benefit to be used. If it's an unauthorized service, yes, you can bill it. So I'm not really sure what questions you had regarding that. You might need to put some more information into the chat to help me out. Hopefully the person that had that question is on. I don't know if they are or not. Let's move on, and we're actually going to focus a little bit on the two types of claims here. But before I do that, let me just ask Karen, do we have any questions in the chat that need to be addressed to finish out that first section?
We just got a question, Tom. How or where do we list the plan codes to bill Medicare? That may be something that you're going to go into.
Oh, yeah, it's going to be on the claim form, but we'll talk about it in just a few moments.
It was the only question we've gotten so far.
Okay, so hold on to that one, because it's going to be in this next section, which is where we talk about the actual structures of the claim and where you want to file everything and what goes on which section of the claim. So keep in mind, Medicare secondary payer claims can be billed electronically if there is one primary insurance. One primary insurance. Once you reach more than one primary insurance, the system typically does not allow this. Now, I say typically because some people have said, oh, I got that to go through. And I was like, wow, oh, okay. Let me explain what you would need to do and how this happens. So a person has an employer-based plan under their spouse and gets in a car accident. Well, could they both be primary to Medicare? And the answer is very possibly. This would make Medicare the tertiary or the third payer. In this case, electronic claims can't differentiate who paid what, who allowed what, who paid first. By the way, that's not for Medicare to determine. That's a state law determination. But it also means you can't file electronically, and we'll talk more about that when we get to the paper claim section, which follows this one, okay? Right now, Medicare is receiving around 95% of our claims in the electronic format. And so for a multi-carrier claim, we actually offer an article on this, and we tell you, go use this article. It'll tell you which loops and what needs to be done under your claim structures and where things need to go, kind of leading to the question that was asked just a bit ago. Let me just open that article up, and then we'll go on and we'll get into some claim data level and all of that stuff. Now, as I said, this article is on our website, so we will come to WPSGHA.com. We're going to make sure, we want to make sure that we're in the Part B section, or you won't find the article. This is when we talked about the Part A section, is when we talked about the physical intermediary standard system. That's a CMS line of business, which is what Part A means here, and Part B here means the MCS. So we want to make sure we're in MCS. Doesn't matter if you're on J8 or J5, the article is the same. Then we're going to go to the Topic Center and we're going to move to Claims. Once we're in Claims, you can search through, figure out what you want. You can do whatever you want here. You can go to the A to Z, filter it through, look that way. I don't really like to do that. I like to use the word second. Oops, I forgot the C. Secondary, because I just think it's easier. Go to this one called MSP Fact Sheet right here. Just Medicare Secondary Payer Fact Sheet. It's the top one. And again, you can search this under any of these tabs. When you're inside this fact sheet, it'll read through kind of some different stuff I went through, and then it's going to talk about, okay, here's how to determine, okay, and then we get to electronic billing. And it'll actually walk you through what goes in every single code piece of information you need. So when you say, where does that type go? Claim primary payer amount line, I just gotta find it. Insurance type code, oh, is right at the top. And it'll tell you, okay, this is where it's gonna translate to for this. Now, I haven't got to paper claim form, so don't be surprised by that. We're just going to focus on electronic for a moment, and we'll get to paper in a little bit. But this will kind of walk you through all those different things. This is where if something breaks, it's good to have this to say, okay, this is where Medicare wants to see it. Are we translating that correctly to Medicare? You may not be able to answer that. You might have to take it to your software vendor. Actually, I can pretty much guarantee you're going to have to. So this is what we're going to talk about right now when we talk about electronic claims. And some of you may not necessarily know all of this. Again, you may see a drop down or whatever. So there's some different things you can do. One, there is claim level data. And this just indicates, Medicare is the secondary. It gives you the type code or the claim filing indication code, the primary payer amount, the claim contract information, and the claim adjudication date. Once we get done with that, we do move to the line level data. Now we can process some claims absolutely without the line level data, but then we're going to process it solely based on the primary payer information above, which, that can be a bit of a difference because we're going to assume that the primary payer amount is based on all of these different lines. Well, what if that individual line actually wasn't paid for? That's why you want to make sure that you put the line level data. So let's say the primary says this line right here is not part of our plan. You can tell us that in the line level data versus the primary data, which is above. So the primary data at a claim level versus the line level. Okay, so on the line level, you can put the line adjudication information, the line adjustments, and the line adjudication date. Again, the reason that we would want to do this is if something is very different. So for instance, we did pay on the claim and we did process the claim, we gave you an allowed amount, but this line isn't considered as part of that because it's not part of our coverage. If that does happen, we can actually consider that one line to be primary for Medicare. So that's why we would ask that you please fill out that portion both ways. Claim structures, again, here's those loops and IDs. I did just show you where I got all this information. I don't know exactly what the person was asking for. They just asked for the loops. So I'm gonna hope this gives it to you. I'm not gonna read through these because hopefully it does what you need. If not, please put that back. I can talk more about it. Okay. Some of the electronic fields, please make sure that when you have a payer responsibility sequence number, you're using a P or an S, primary versus secondary. This is causing us to reject the claim. In other words, we're not even processing it because we don't know what's going on with this. Also, claim filing indicator MB for Medicare Part B claims. Medicare Part B is defined by the Medicare line of business, not the Medicare benefit category. A Medicare line of business B equals MCS or multi-carrier system claims, not the benefit category B. So we want to make sure we're getting these correctly. Sometimes we have this happen and people are putting different things in there and we don't really even know what that is. Okay. So for MCS, we're always looking for MB. The claim level, again, primary paid, the amount segment loop, the other subscriber information, you do want to put a dequalifier. That's the item that's most frequently missed. The total amount primary paid on the claim, 0 is allowed. The primary doesn't have to make a payment. Well, why wouldn't they? Well, think about it. Could they apply it to deductible? Could they do a variety of other things? So just make sure that you're doing that. One of the fields that is commonly missed also is the obligated to accept as payment in full, or the OTAF field. This is when you have a contractual agreement between that primary and you. How much do you have to accept as payment in full? That can be different than what you actually build, and you want to make sure that the OTAF is used. The system can determine this. It tracks the contractual obligation and the amount from the submitted charges. So how much are you obligated to accept versus, and then it gives us an adjudication date. Paid or process date, it's very simply the date that the primary did whatever they did and they sent you the remit notice. It's going to have a date on there. Remember that this can be a process date. This is one thing that we've had issues with. Someone said, well, I didn't have a paid date. Well, did they apply it to deductible? Well, that's still a process date. Did they deny it saying, we're not making a separate payment? That's still a process date. That's why we call it a paid or process date versus some people call it the primary paid date. And so when you read some of the literature and information, you'll see primary paid. It doesn't necessarily equal a paid date. Let's talk a little bit about some of those line pieces that we will look for. Primary payer applied line level adjustment. Now, again, the procedure code, units billed, you've got to have all of that. I was asked a very specific question, and it's what happens when the primary payer uses a different procedure code than Medicare? This can happen. What you will do is bill the primary payer whatever procedure code they need, whatever procedure code they need. Then within your notes, you're going to say, hey, when we billed Medicare, we translated this to, again, whatever that is. Now, it's important to make sure that that's within your notes so that if it ever gets called back as a claim and we actually ask for information, whether it's your Medicare administrative contractor or one of the other review entities, they know why you changed the code when you went to bill Medicare. So for instance, someone said, well, the exact scenario that we were asked about is that the primary payer doesn't pay for an annual wellness visit or an IPPE, initial preventive physical exam. Instead, they do the of the annual physical. That's fine. For them, you need to bill an annual physical. For Medicare, you need to determine which code is appropriate. An annual wellness visit, is it an annual, did you meet all the criteria for that? Is it an IPE? All of those different things. All right, so that's a little bit about that. So make sure that you have those different types of things in there. But again, if you're looking for that procedure code information and you do have to adjust it, we just need you to put it within your notes, and then you're going to bill Medicare whatever they're requiring to bill. Must match the payer ID for the primary. And then this is your case segment. Claim adjustment reason codes. What are they doing with it? This comes off of their remittance advice. So this could just be an example of what you would see. CAS, STAR, patient responsibility, okay, and these are the codes. Patient responsibility 1, code $7.93, and hopefully that all makes sense when we take a look at that and what goes into each segment. Your line adjudication date, this is just the date, the time qualifier, those pieces of information. Again, how to put it together. So DTP segment on the loop 2300, this is your segment. Then you've got the 573 date time qualifier, date time period, and then the date. So it's just going to say this is what we're looking for. Hopefully that makes sense to everyone. If not, and you do need more instruction, I would recommend that you go out and check out the information within that. Now, it doesn't change based on insurance type. So these fields don't change. They're all the same. So if you're out here and you're saying, what field do I need to put something in? Come back to that article that I showed you and say, okay, here's my insurance type code. It needs to be in this field and it needs to be, you know, what it is. So required when the destination payer is Medicare and Medicare is not primary. This is not always required. You don't have to necessarily do that. This is going to translate for you. Some of you may never actually see this code number. Okay. You may say, what type of primary insurance do they have? They have working age insurance. They have Medicare but working age. And the system will do that adjustment for you to put it into this field. Okay, so it's very different. All right. Now, if you are talking about other types of claims that we do take, of course, we always take the paper claims. Now, I'll give you one example of when a paper claim may be submitted, and this is that third insurance. So this is definitely something you want to do. Now, I will tell you there's a full set of instructions for completing this claim form and all the information that's needed, and I'll talk more specifically about certain items, but they're in the internet-only manual system, the day-to-day operating instructions for Medicare. Before we get too far into that, this is what you're looking for. Medicare. On the cms.gov website, you will go to the term Medicare. Regulations and guidance. And then, once you're inside there, you go to manual. Sorry, this is stuck. There we go. And then once you're inside manuals, it's internet-only manuals. Scroll down a little bit. Now, there is a whole section in the internet-only manuals called Medicare Secondary Payer, but it's not going to teach you how to put information onto a paper claim form. On the other hand, the Medicare Claims Processing Manuals will do this. And there are a variety of chapters. This is where we talk about the other billing requirements that I just briefly mentioned. That's up here, but I want to scroll down. Stop at a couple of different ones. We just finished talking about the general EDI and business requirements, which is 24. The paper claim 1500 sets is 26. So this is where you want to go for all of these different pieces of information. So I'm going to go through this, and I don't want you to think I'm not going to go through, but I want you to know where I got my information. Okay. So paper claims, a little bit different. There's a couple of things that can actually be different based on what the manual says. So we want to make sure that if you're having a problem with electronic claims and you can identify that it is a system issue, you ask for a paper claim waiver, which is under ASCA, ASCA, or the Administrative Simplification Compliance Act, and it allows you to submit for a period of time, and you will define that period of time within the exception. The reason for that is we don't want you to stop getting paid. Like, we know that for a lot of people that's too much, but we also know systems break, things happen, updates occur, unexpected things happen, or you happen to have the one or two claims for that tertiary situation. Now, those you don't need to ask for an exception for because there's such a minimum amount. Okay. But let's go through some of the stuff about the paper claim. There we go. So this just basically tells you the fields that are needed on a paper claim form. Now, I did not highlight everything. I didn't say, okay, yes, you still need to put, this is a Medicare claim, this is your insurer ID. These are all your standard fields. Please don't ignore those. Make sure all of those get filled out. However, insured name, patient relationship, item 6467, insured's address, 10, 11, those are your primary ones. I was specifically asked about 9. 9 is supplemental information, so we'll talk more about that. We're going to go through these different fields just to make sure everyone is aware of what needs to be there, because there's a couple of them that are going to be a little bit different. So let's get started with item 4, paper claim only. If there is no insurance, then you'll state that. Medicare. Again, this is paper claim only, right? If there's no other insurance, then Medicare. Done. When insurance is the patient, when the insured is the patient, enter the same. So if it's not a spouse, if it's not a child, if it's not someone else that they're qualified under, you're going to need to tell us who that is, and follow that field. Last name, first name, middle initial. Someone asked if they have to have a middle initial. I've never seen us reject for not having a middle initial, so I would say no. If the insurance does fall under the person, the Medicare recipient, then yes, you're going to want to make sure that you put same. Just don't fill it all the way out. You don't need to do that, okay? Then we fall into item 6. It's simply a checkbox or a circle box, and you pick the one that you want. Is it them? Is it their spouse? Is it a child? Is it other? Okay. Somebody did ask me, what does child mean? And let me give you an example of a child. So you become a dependent of your child due to a disability or due to dementia, something like that. So you actually have a state appointment of representative, whether it's health and whatever, and that child is responsible. So therefore you can be on their insurance, and that's a state decision. That's not a Medicare decision. If that is the case, that's when you use child. Somebody also asked, what is other used for? Let me give you an example here. You have a child that you are fostering. You are not their parent. It's not you. It's not their spouse. It's still your child, right? But it's not it's a foster situation. It's not your legal child or anything. That's when some people would use other. I'm not going to tell you which one you have to use. Any of them should work. It just depends on the relationship that you have. Those were the situations that were given to me or questions that were specifically asked. So I wanted to make sure I addressed them. In item 7, it's just the insurance address, city, state, zip code, all of that. Make sure everything is the same. If the beneficiary is the insured, then we would also expect you to put the same here. So if 4 says the same, then 7 should say same, right? Go back to the address field for the patient. Hopefully that all makes sense. But you can't leave them blank. Please don't do that. That causes other issues. In item 10, do select a yes, no for each one of these. The only one that has a caveat is the auto accident. Can you tell me which state it was in? Now that, if you remember correctly, was when I gave you the example that it could be a liability, or it could be, I'm sorry, I forgot the other one. No fault insurance. Sorry. So that's why this state matters to us, is we're trying to figure out what it falls under. They both process the same, right? They both process the same. So is it an employment base? Is it an auto base? Is it another accident? We want to make sure we're getting whatever we need here. Then 11, this is just the insurance information itself. So the group number, the insurance 8-digit birth, the insured's 8-digit birth year, sex, all of that. I do want to point out that 11D is not required and not used by Medicare. So if you're filling out 11, you can skip D. This is not something you need to do, but we do need 11 itself, then A, B, and C filled out. And last is item 9, which I did jump a little bit ahead and I talked about already. This is when there's a supplemental insurance. This does not need to be filled out all the time. It's not even required for a primary, but so let's say that they have Medicaid. You could put Medicaid and all of that information in here. That is one of the correct reasons to use this, right? Medicaid always follows Medicare. So that's what they're looking for here. This is not used in a primary situation. All right, so we've got electronic claims done. We got the basics. Let's move on a little bit. And we're going to talk about some billing situations. First billing situation that we always get asked about is conditional payments. Medicare makes a payment when the primary insurance did not decide and it is not an employer group health plan. So in other words, not work related. So it could be liability, no fault workers' compensation, something like that. You file to them, and after 120 days, you don't have a decision, right? There's nothing there. Medicare can then make a conditional payment. The conditional payment is designed to stop you from billing the patient so that you get money, you have a revenue. But then once everything is finally settled with this insurance, the patient may be liable, the insurance may be liable, or you may be having to send us money back. It all just depends on what happened. In most cases with a conditional payment, a lawyer or representative reaches out to the Benefit Coordination and Recovery Center. They work with them to get it done. It could also be the patient doing that because they can all be held liable based on the conditional payment. Now, for an MCS claim, a multi-carrier system claim, there is no field that automatically triggers a conditional payment. We ask that you put something within the narrative field. We get it though, because sometimes that doesn't work either. So what do you do from there? You can file an appeal, or you can file an appeal and say this is a conditional payment. That's fine. You can call customer service and say I'm just looking for a conditional payment. What do I do? We can get the claim processed in that way. It's because the system just doesn't have anything to do with conditional payments. Doesn't have any fields to indicate that. Doesn't have any special requirements for it, which causes other issues. Okay. There are also times when a primary pays a claim in full. One of the key statements people trigger onto here is that they're not required to submit a claim. That is correct. CMS says it's primary paid in full. There's nothing more we can do with this. Guess what? You don't have to submit a claim. Here's my caveat. Here's my recommendation. Always submit a claim, even if it's paid in full. Now, there's a couple of times. One, if the patient still has an outstanding Part B deductible for the year, you do need to submit a claim because we can apply those services on that claim that are already primary paid in full to that deductible and waive that portion. So I really do encourage you to do that. Okay. It's also a notification of a once in a lifetime benefit, right? We're not making a payment, but the patient's had this benefit. Well, then they don't get it again. An initial preventive physical exam would be an example of that. Recording certain time restricted services. An annual wellness visit you can have once a year. Okay, well, if we don't know if they've had it, we'll allow other people to file for it. So that's another example of when we would encourage you to do this. I would also say allows Medicare to have a claim on file. What that statement is saying, how many of you have filed to a primary, they've come back and taken their money back, but it's after the 1 year from the date of service, which is the time frame in which you have to file to Medicare. Medicare does not waive timely filing. In other words, you have 1 year. Medicare will not waive timely filing. We're not, as a Medicare administrative contractor, allowed to do that. Therefore, we have to make sure that it's filed within that year. So if you file it to us, even if there's nothing to pay and we apply it to deductible, or we don't do that, maybe we just track that it's there. If something happens, we can work with that original claim, which was filed timely, to get you a payment, or to get you to consider that again, to get us to look at it to figure out whether or not we owe you a payment. But without that claim being on file, we will not be able to do any of those things. Obligated to accept this payment in full. The beneficiary isn't responsible for the amounts between the billed amount and the obligated to accept this payment in full. If you have a contract, that's what the obligated to accept this payment in full relates to. So there are times when that will be on the claim. Use the primary EOB to determine this. It's your billed amount minus your discounts, your adjustments, anything that you can't bill the patient for. That's what we're looking for is obligated to accept this payment in full. It's what are we allowed, or in the Medicare realm, what's the allowed amount? What's the primary payment going to be able to consider? Now, there are some where they say, hey, we're only going to pay you this much, but that write-off amount doesn't apply. This is just what our contracted amount is, and so you're not obligated to accept that as payment in full. You could bill the patient the rest of it. In this case, an obligated to accept as payment in full does not apply. But it's really up to the primary to calculate that, if that makes sense. Hopefully it does. It gets a little bit trickier because, again, it's based on the primary, based on what they're putting on that remit notice that they're sending you, which is what you'll use to translate for Medicare. I was asked for the payment calculation for MCS claims. I will tell you, we do have a payment calculator. It does work as long as you understand the terminology, but it's a 3-part process to calculate this payment. So here's the thing. I'll go to the payment calculator, but I just want to talk about what you'll need. The actual charges, or the obligated to accept as payment in full. We need that. We need to know what the primary paid. Well, that makes sense. What would Medicare have paid if it was primary? So is there deductible? Is there a co-insurance for that service? What's going on? Is it the standard 20%, or is it preventive where there isn't one? Okay. The highest allowed amount minus the amount paid by primary. So what we'll do is we'll look at what was higher, the Medicare allowed amount or the other insurance allowed amount. We'll take what was paid and we'll determine a payment there. Then we compare those 3 to give you a payment amount. Now, if you're interested in using the calculator, which does work for this type of a claim, you'll come back to our website. Go back up to the top because I got to get up to the tools section. So here you are. You can be anywhere you want. You'll notice you'll have a tools drop down. On the tools drop down, go to all tools. And just kind of scroll down a little bit. And on the 3rd line on the right side, you'll see MSP calculator. If you stop right there, hover over it, it's going to tell you when it doesn't necessarily apply to certain things. So for instance, liability, no fault, workers' comp, there's a variety of other factors that figure in. So you really should only be using this for an employer-based plan. And then what it will ask is all of the amounts that go into it that I just talked about. And then what it will do is calculate. It'll calculate. It'll give you how much Medicare will pay. So let's say the billed amount is $100. You are obligated to accept $80. The primary paid $50. I'm sorry. Yeah, $50. There's a $30 copay for this one. Medicare, on the other hand, said, no, we're only going to allow it $75. There was no deductible. Okay. There's a standard 20%, so you don't have to check anything. It'll calculate that for you. So what's the primary allowed? 80. Why? Because there wasn't obligated to accept his payment in full. And then no, there was no late filing. If we hit enter at this point, or I'm sorry, if you do have to hit add calculate, it'll tell you Medicare will pay you $30. Okay, but Medicare only allowed 75, but you got more money because you got a $50 payment and a $30 payment for Medicare, which means you got the total obligated to accept his payment in full. This is a correct calculation. This is one of the ways that that works. Okay, so I wanted to point that out because it is correctly to calculate it, and Medicare is going to pay you that $30. I think that that's where the question came from, because what happens when you get that little bit of extra money? That's what it is. You got a little bit more than here. Now remember, Medicare does say you can't bill the patient, and that's our next slide. So what Medicare says is use this formula. How much did you get from the primary? How much did you get from Medicare? Yep, okay, that's a total dollar amount. Then subtract the Medicare allowed amount if you have 0 or more. So if you have a negative amount, that's what's owed to you. So hopefully that makes sense. What's owed to you is what the patient or what we have not paid for above the Medicare allowed amount or to the Medicare allowed amount. So in this case, let's say that Medicare, let's jump back to the calculator. Let's say that the Medicare allowed amount was 75. The OTF, they did not pay anything. So they allowed it. You're obligated to accept his payment, right? Less deductible, there wasn't any. And now if we reset this calculator, you'll see that our payment is $60, but you actually can still bill the patient up to the 75. So they owe you the $15 co-insurance because the primary applied it fully to deductible. Does that make sense to everybody? I hope it does. And so let's say, so you just want to make sure you're checking each one of those fields to do this correctly. Okay. All right, so that's our patient responsibility. We'll give you a bunch of different resources, and you can look at these at, your will. Let's do some question and answers next, but I want to start with the pre-submitted questions that actually came in as part of registration, and then we'll open for any questions that are remaining within the chat. I don't have a bunch of pre-submitted, I only have a few pre-submitted questions, so bear with us as we walk through these. When we file to the secondary payer, we'll sometimes get a statement saying misdirected. So this statement simply means that when it was sent from us to someone else, the information wasn't sent the way that it should have been. So maybe it was misdirected forwarding to the correct payer. What that means is that we originally didn't forward it to the correct payer. There's updated information. Something happened, and so we're forwarding on to a secondary. Again, another one. This has nothing to do with primary, though. Medicare is in this case, Medicare is the primary, and we're forwarding it. So again, this is a coordination of benefits thing, not anything related to the primary payer. How do we work with coordination of benefits if the other carrier says they are not primary and Medicare says they are primary? One, there's a variety of things that can happen with this. And one is that they are truly not primary, but we don't have that information. So we know that it's a plan such as Blue Cross Blue Shield, which can be primary, but it can be supplemental. We don't know what's going on. That's up to the Benefit Coordination Recovery Center to update. Now, how does that update occur? Couple of different ways. One, the patient can have it updated. If that's not possible, you can have it updated by getting information from that primary insurance. The primary insurance themselves can call and have it updated. So there's a variety of different things that will actually factor within that. I will tell you that until it's updated, our system will not let your claim process. So what could also happen is you could bill it to that other insurance in the meantime, get it announced saying, yeah, we're not primary. Then you can bill to us, Medicare, saying, hey, they say they're not primary and we'll consider those charges. It's just a lot of back and forth and a lot of different options there. Let me show you where to find that Benefit Coordination Recovery Center contact information that I just spoke about. So when we're on the CMS website again, www.cms.gov, I gotta get back up to the top here. We're gonna go back to Medicare again. When we scroll down, there's actually going to be a section called Coordination of Benefits and Recovery. I prefer just simply to go to the overview. I think it's the easiest place to go because once you scroll down, if you watch this side over here on the left navigation area, there's contacts. And from there, you can get through all the different contacts for a variety of different reasons. The data collection is a coordination of benefits that I was talking about. It tells you how to contact them here, gives you a fax number, gives you all that information that you may need. Now, keep in mind, if you keep scrolling down, it's going to give you a variety of other contacts that you might need. But I will tell you that you don't normally contact them beyond updating a record. If you work with us, we may ask you for money back, and we as your Medicare administrative contractor would do that. However, the patient or a different insurance or whatever the legal situation is, they would work with the Benefit Coordination Recovery Center, which is why it's broken up the way that it is. Hopefully that all makes sense to everyone. Let's jump back to our slides for a moment. Our secondary claims are being rejected, trying to find out why. This question is way too general for me. Karen and I, we have no idea why it's being rejected. I would have to look at the claim individually and then look at the individual audits and edits. I don't have access to those audits and edits. That's through customer service. So you really do have to contact them, give them a claim number, and let them look it up. All right, next question. Is there a special form to fill out for a person with a different specialty insurance that's not recognized by WPS? Not that I know of. I have no idea what the special form would be. We don't do the coordination of benefits. We don't update those records. So you do have to go back to the BCRC to see. I don't know other than that how to answer that because we wouldn't do any of this. This is not our process. We just simply say it's in the system, yes or no. Therefore, you can bill yes or no. What is the best way to fix a secondary claim if it's not billed correctly? Submit a new claim after it processes. Let it process through the system. We do not want it duplicating out. So stop, let it go through the system. Once it's through the system, then you would submit a corrected claim. Now, a corrected claim is for the MCS system is technically a new claim with whatever information you need. Now, sometimes some people say, hey, I'd rather do the appeal. That's on your decision. If you have appeal rights, your remit notice will contain an MA01. The MA01 simply says, go ahead and appeal it. I can't tell you which one is better. The reason that some people really like the corrected claim is they think it processes faster. It absolutely can. So I don't have that, but just remember that in MCS, when we use the term corrected, it is considered a new claim. You can't actually go into the system and correct it. Could you do a clerical error reopening? If the system allows it. However, a lot of times with Medicare secondary payer claims, they're too complex for the system to understand what you want without submitting it as a new claim. I have one more pre-submitted question, then I'll ask Karen to look at the chat and see what we have going on. What's the last pre-submitted question is, can you do a full review of Medicare secondary payer? My answer to you is, I'm sorry, I cannot. There's just not enough time in this webinar. We actually do a series, and they're not built upon series, but there are a bunch of Medicare secondary payers, so we just can't do that. That's too many for us. Karen, do we have any questions in the chat?
Tom, we do have a question in the chat. Do providers have to send claims to auto, workers' comp, or liability insurance if the service provided is unrelated to the auto, workers' comp, or liability insurance?
Oh, no, you don't need to do that. Because the diagnosis code is what drives that, And sometimes you're actually going to have a diagnosis code that's the same or similar. So the system hits it and goes, oh, this is workers' comp related, and it's not. Then you do have to do an appeal. Unfortunately, there's no easy way to tell the system, hey, don't do that. But no, you do not need to send that for primary denial. No, there's no reason for that. If it's workers' comp, liability, auto, whatever, all of those are primary when it's unrelated to the condition. But remember, Medicare does use a diagnosis code to determine relation. It is not an exact match. It is a family match. So similar is also used in a term there. So those are some things to consider that might actually happen. Any other questions?
That is the only question we've gotten.
All right, perfect. Let's move on. If you do think of any questions within the next 7 days, by all means, feel free to email those to us. The slide has the email address. I know it says today's topic. Please note that's not in quotes. If you look in the chat, there's something in quotes called MSP MCS claim. That's what I needed in the subject line. This is just to say, hey, it's a space holder on my slide. But please email us those and we'll get you back. Remember, if it's claim specific, we can't answer. It's got to go to customer service. Next, if you need a certificate of achievement and you dialed in, you will have to do the follow-up email. Tell us, I need a certificate of achievement. Give me your full 10 digits for the phone number so that I can look up and verify that you're on. We'll get you a certificate. However, if you did not dial in, you did not use the phone, and you actually entered an email address when you came in, we'll go ahead and automate that process for you. You should be getting that right quick here. It's an email that comes from our system. It's not something Karen or I actually physically send out. So make sure that you check for that. Check your spam folder. Look at the bottom of it. It'll say certificate and it'll actually show you how many contact hours. A question I did receive is how many CEUs does WPS offer for this course? We don't offer CEUs. We offer contact hours. Your governing body has to determine whether or not they will issue you CEUs. We give you a contact hour. They tell you whether or not it's accepted. I can tell you certain things like AAPC will accept it. So that's kind of how this works. Also is the survey. We're going to give it to you right here on the top, and I'll talk more about that in just a few moments. But you can always give us feedback. Tell us what you think. On the survey, a little bit about the survey. It should be given to you about Medicare Secondary Payer, which is this course and the MCS course, but you can also have a question related to how we do as an overall max, so you're going to grade us that way too. But we also want your feedback. Did I do good? Did I do bad? Was it ugly? My explanation for that is, what did I do well, right? What could I have improved on? What would have helped you a bit more? What would have given you better answers? Was it ugly as did the resources work? Does my PowerPoint look good? Was there things on the PowerPoint that would have not helped you? Would have been better done in a different way? So good, bad, ugly. Give me all of that feedback. That's great. By the way, I'm going to give you a redirect after closing, which is going to look like the bottom box. You can simply click continue. It'll take you to the survey. If you're taking this in an encore, we're going to give you a whole nother method to do that, and that's going to be in the online survey picture, and you'll take it that way. But don't forget to check your chat. There's a link in the chat. You can take it right now while I finish up talking. Few people did ask for what we do with the survey feedback. Well, we make changes. A couple of those changes do include the chapters to YouTube channel. Now, those would be on an encore and being able to break it down a bit more. We also have done training indicators. We've also done the Medicare Education Expo, which is not listed on here, coming up, gosh, just a couple of weeks from now. And then we'll continue to do those. So give us topics so that we have that available to you as well. That's it, y'all. Thanks for attending. I hope you got something out of it and you have a great day. Please take our survey and provide us any kind of feedback you want. On behalf of myself and Karen, you are welcome to send us questions, and thank you for attending. Have a great day. You may now disconnect.